Hello, Houston, and hello, world. This is Vicki Cruz with the Hero Network. And here with me is my co-host who is totally on fire and is going to have full of questions. But we want to introduce to you someone else. Let me just first, Victor Escalante. Let me give it to Victor. Victor.
Vicki, good morning. How are you?
I'm great. How are you?
I'm great. I'm ready to go. It's like we want to educate our audience on childcare, on prenatal care especially, and especially postpartum.
Absolutely. And with that said, we have someone with no further notice. We're going to move on to someone here who's impacting all diverse communities throughout Houston. This Dr. Lalani is going to share with you why it's important, the developmental stages of prenatal, but beyond prenatal. So exciting stuff, Victor. Thank you so much. Jess, I know you're so ready for this. I mean, you sent me so many pertinent information, and I'm like, man, we had an opportunity to meet Dr. Lalani. So thank you so much for watching. Thank you so much for sharing. Hope Clinic, welcome.
Thank you. Thank you for having me. It's a pleasure to be here this morning.
Absolutely. Go ahead, Victor.
So again, we want to thank Hope Clinic for sharing you with us today, taking you away from your patients. Tell us, Dr. Lalani, how did you get started in first OBGYN?
So I knew from a really young age that I wanted to be a doctor. I didn't know what kind of doctor I wanted to be. I got some influence from my father, who came to the U.S. from India in the 60s for his training. And he was such an amazing influence on me and a great role model for me. But when I started going through my medical school rotations, you rotate through all of the fields. And I fell in love with OBGYN, and I just loved taking care of moms and taking care of women and helping them be the healthiest they could be.
But what's really impressive is the actual program.
Yes.
I know that I have 3 kids and 3 children, and of course they're not children, they're adults now, but never have I heard such a concept that engages community, educates, also possibly even provides or creates accountability for these mothers. Share with the audience, share with the listeners as to what you're doing that is so different than many of the clinics that are out there. I mean, you talked about how you've taken them in, how you have monthly meetings. You want to share that?
Well, as you know, education is power. And something that we have implemented at Hope Clinic is called Centering Pregnancy. Centering Pregnancy is a different model of prenatal care in which we take moms that are all pregnant and we do their prenatal care in groups. By doing that, it's a 2-hour session. And by doing that, we have a lot more time for education. So it's so rewarding for me as a provider, and our patients love it. They have instant support from other pregnant moms. And mostly we have time. So we have time that we don't have in our one-on-one visits to educate.
One-on-one visits is usually only about 15 minutes, isn't it?
I mean, to be honest,
10?
It's about 5 to 10 minutes.
5 to 10, yeah. So
because
imagine that.
I'll have 20 plus patients scheduled in a day. So if you can imagine, I have to get through my day pretty fast. But this way, I have 2 hours with my patients. So it's amazing. We get to talk about various things from nutrition to common pregnancy symptoms, what's normal, what's not, when should you call your doctor, how should you prepare for this pregnancy, how can you be the healthiest you can be. And we even have some time for mindfulness and other activities. We share food, we have healthy breakfast prepared for them. And so that they can see that it's you can eat healthy and it can still be delicious. So many things that helpful things that come out of centering pregnancy.
I'd like to drill down on centeredness, Dr. Lalani, because again, that could be a show in and of itself. But why is this critical for your program, centeredness?
Centering is critical because patients need to hear from their doctor. The source should be your doctor, not Google and not other sources that might not be so reliable. Mm-hmm. They need to hear from their doctor what we want them to do, how we want them to be healthy. And we not only want to empower them with knowledge, but show them that they make them feel that they have the ability to be healthy.
Yes. So I want to give out the number, Vicky, if that's okay.
Absolutely.
To our viewers. Viewers, that phone number in our studio that you can call live, we will answer your questions live, is 832-997-2728. Again, 832-997-2728. You can call us and you can ask our guest, Dr. Lalani, and she will gladly answer your questions that you have about childcare.
Yes. So the Hope Clinic, how long has it been in Houston? I know that there's 5 clinics. You want to talk about just when it was founded and just a little bit of history about the Hope Clinic?
So Hope Clinic was founded by the Asian American Health Coalition, and it started as a volunteer-run small clinic in a church. And with the vision of a few of our founding members, it's grown. And in 2012, we became a federally qualified health center, meaning our purpose is to be in the community as a source of medical care for those who are underserved. So our mission is to provide care to uninsured and underinsured population, and provide high quality care in a linguistically competent and culturally competent manner. So our doors are open to everyone, but our goal and our mission is to serve the community and have high quality health care in the community.
I know, and I do appreciate that. I was looking at your website and just, the diverse communities that you do have. I mean, you have in every language.
We serve patients in tens of languages. I would say we probably serve patients in at least 50 languages. Our staff in itself speak 34 languages. And if we don't have a staff member that speaks a language, we use an excellent translating service to make sure that we can communicate with our patients in the language that they're most comfortable in.
That's awesome. And so what impresses me too, Victor, is it's how you take, because relationships are so important, right?
Absolutely.
When you have a doctor that's going to really care, you're able to just be open. Just imagine a pregnant mother for the first pregnancy. There's nervousness, there's the unknown, and when they have that and they're listening and engaging with other pregnant moms, and just the stress levels are probably reduced just a bit.
Yeah, they know that they're not alone in this. Mm-hmm. There's other moms going through exactly the same things. Some of our patients exchange phone numbers, create their own little chat groups, and they have instant support, which is so important.
Which this is the way it used to be. We're coming full circle back to a village, a nucleus,
it takes a village.
A nucleus of people coming together, supporting each other, and helping each other to survive and to get ahead.
And not only that, though, you're starting from the OBGYN side, and then you just carry on this relationship, not with the mother, but you're carrying it on by transferring over the child into the hands of a qualified pediatrician, to where now the developmental for the child is basically monitored with relationship with the mother. So it's definitely bonding moments. I see so much in that.
Sure, we have the science that if the mother is okay, the child is going to be okay, because the child doesn't know prior to 12 months, or actually 2 years, depending on which data you look at, the child doesn't know that it's a separate entity. So it feels as an extension of the mother. And if the mother's not okay, then the child's not going to be okay. So you're ensuring that proper development of the most critical phase, the bonding phase.
That's right. Physical and mental health are so important for a developing fetus. And by educating our moms, making them feel supported, doing our mindfulness activities, teaching them about nutrition and being as healthy as they can be, we're taking care of that child before he or she is born.
That's right. Not just before they're born, but also staying with the child, because as we know, postpartum depression and postpartum it's real.
It's real.
It's real. It's a real thing of how women fall into a severe manic depression. And it affects the developmental growth and the relationship bonding with the mother.
Yes, in the United States, we tend to be isolated, and we don't have the village around
Yes.
us, as you said, for the support that's necessary. So sometimes we have moms, dads go to work to help, bring home the food, and they are alone, taking care of the baby alone, and sometimes waking up at night alone and need more support. So by developing a support group and resources and giving them all of the resources that they need during the pregnancy, letting them know who they can reach out to if they're starting to feel anxious or depressed, giving them the resources that they need. They know that they can call us at any time if they're not feeling well. Sometimes their partners also come to the group, so their partners become more aware as well as what signs to look for, and encourage them to reach out when they're not doing well.
Wow.
What has surprised you the most as a result of this program with the patients?
What surprised me the most is that I get to know my patients on a level that's completely different than I do in that
Right.
exam room. I get to know what the real struggles they are going through. What are the real problems that are maybe sometimes the source of anxiety and depression, and being able to connect them with the resources that they need to help them.
Just safety. That sounds like safety in itself.
Yeah.
Safety, security
Sure.
for the family, for the whole family. Because once the mom and the wife has those resources, I mean, it creates for healthy families, healthy boundaries.
Yeah, imagine the husband going with the family for care and being educated right along with the mother,
Correct.
the expectant mother. That's I don't know if anybody else is doing it. Are you the only one in Houston, the greater?
No, there are
Houston
other
area?
health centers doing centering pregnancy.
Oh wow, that's interesting.
Yes, and there are centers all over the country doing centering pregnancy. It's
What
been
other-
around for a while.
It's been a while. So what other resources do you provide your patients?
So centering, we have many topics that we cover. We cover being prepared for your newborn. How do you need to, what do you need to start thinking about to have ready for your newborn? Do you have your car seat? Do you know how to use the car seat? Do you know how to baby-proof your home? Do you know that babies should not sleep on their stomachs? Do you know that we also talk about intimate partner violence? Are you in an unhealthy relationship? How can we help you have a healthier relationship with your partner? Have you decided on your pediatrician? Who's gonna be your baby's doctor after delivery? How do you feel about breastfeeding? Have you thought about, are you gonna breastfeed this baby? And do you know that we have a lactation consultant that can help you if you're having difficulties? Breastfeeding can be hard. It
Very
can be
hard.
painful. And so all of these resources, we let them know that we have a Urban Harvest. A farmer's market comes to us once a month, and they have healthy foods at very, very reasonable cost, healthy produce at reasonable cost. We let them know that we have a dietitian on staff, and that they can meet with the dietitian. If they have gestational diabetes, we're here to help them to manage having the best outcomes for their babies. So many resources.
Nice.
Dr. Lalani, I'm the nerd of the show. So I want you to talk to us more about feeding your child through breastfeeding, and what are the benefits of that when we look at how our biome affects us for our entire life. Why is that a recommended, if the mother is able, a recommended way of raising your child?
So we know that breastfeeding is best. Breastfed babies have been shown to have higher IQs, less asthma and allergies, less GI troubles. They tend to be healthier weights. So there's much research out there showing that breastfeeding is best if mom is able. We never
Yes.
want mom to feel that she was a failure if she couldn't breastfeed. We just ask that you try your best. Breastfeeding is also green. You don't have to use bottles. You don't have to, clean the bottles. You don't have to take bottles and formula with you everywhere that you go. So breastfeeding is easier. It's more convenient. If you want to breastfeed your baby at night, you don't have to actually get up and go prepare a bottle. You're ready to go. So breastfeeding is so beneficial to both mother and baby, and so at so many levels.
Yep, and it comes with a good comprehensive, the education part on what to eat when it comes to the actual malnutrition of the mom, because that's vital for the child's life,
Plus, think of the bonding between mother and child during those moments.
Not to mention the bonding.
Yeah.
So 30 minutes up to eight times or at least per day. It's just you and baby. There's no better bonding than that.
Absolutely. So when on the pediatrician side, my question is what age, up to what age do you take or
What
child.
age do we? So we treat babies from newborn all the way up into 18 years until they're ready to transition to our adult department.
So I guess the turnover too, I would say that with your patient turnover is very low then because
It's convenient. We have family medicine, OB, and pediatrics under one roof. So it's very convenient and provides for excellent continuity of care from cradle to grave, as we say.
yeah.
Dr. Lalani, if we have expectant mothers that are watching us, do they have to qualify for, do they have to be screened for qualifications to be accepted into your program?
So we at Hope Clinic, we see patients with all types of insurance, but we also have an eligibility department. So eligibility will work with moms to see what programs or coverage they might be eligible for, whether it's Medicaid, CHIP, or if they don't qualify for one of those, we have very reasonable OB packages that help make it much easier for a mom to get their prenatal care with us. And then centering pregnancy is available at our main location currently, but we're hoping in the next 2 years to expand to other locations as well.
And this is all done in person, correct? There's no internet-based consultations?
This is all done in person, but we have the ability to do Zoom visits too when it's necessary and moms can't leave home.
Okay.
Nice, nice. And what about you yourself? So you talked about your inspirations. I think I told Victor that as a little girl, I've always wanted to be OBGYN, right? He's like,
I have made Vicky's dreams come true. She wanted to be a broadcaster, so we're now broadcasting live stream and on TV, radio. What else? You want to be a OBGYN? Maybe you can go volunteer.
no, not anymore. Not that I couldn't. I mean, I'm just like, I take
you bypass that phase.
Yeah, it's like, yeah, I just no. When I was a little girl, that was my passion. I was like, oh my goodness, if I could just sit here and deliver babies all day long. I deliver, babies in a different sense,
Yeah.
where it's
Yes, you
development.
do. Yes.
Deliver them from a mindset of hey. I want to just ask you. I mean, what is it like going home every day? You see your patients, you see these children, you see these moms. I mean, what does that feel like?
So rewarding. I mean, I found my passion at Hope Clinic, where we help the underserved population of Houston. And I get to help patients who have just come to the country or may have been here for a while but going through a rough patch, get high quality care. So it's so rewarding, and I wouldn't have it any other way.
Wow. Where was Hope when I was having babies?
Yeah.
And so there's 5 clinics, and 2, if you're watching the show here and you're in the north side, there's 2 that's here in the north side. Is that right?
We have 2 locations in Aldine. We have our Aldine clinic, and then we have our Aldine Meadows clinic, which is a school-based clinic on the campus of Aldine ISD, and shares land with the Aldine ISD, the middle school. So we have 2 locations in Aldine, and would love to be your prenatal provider.
And so Southwest Houston.
And then in Southwest Houston, we have our main location in Alief. We have one slightly east of that off of West Houston Central Boulevard and Westheimer. And then we have our corporate location, which was our original location in Chinatown area off of Corporate near Bel Air.
I'm hoping to hear a hospital soon where you can actually deliver babies in a hospital. I'm like,
Well,
thank you.
we do.
Oh, do you?
We do deliver babies.
Oh,
Yes.
you said you have a midwife.
We have a midwife, but we also have 7 OBGYNs that deliver babies at West Houston Hospital, HCA West on Richmond.
Wow.
So they can they have a through line without skipping a beat from prenatal all the way to
We take
birth
care of our
and
patients from
postpartum.
prenatal care through postpartum delivery and postpartum care.
Oh, wow. That's
Explain
impressive.
to us what is the difference between the centered pregnancy program of Hope Clinics and traditional medicine.
So, whereas your traditional prenatal visit will be a one-on-one with your doctor, where we take your vital signs, collect your urine sample, listen to the baby's heartbeat, and answer any questions, give immunizations that are due, and do that in 5 to 10 minutes when we don't have a whole lot of time to talk. Instead, centering is a prenatal visit that's anywhere from 90 minutes to 120 minutes, where we do a quick one-on-one visit, listen to your baby's heartbeat, take your vital signs, but not only take your vital signs, but show you how to do your own vital signs. So that's empowerment. And then we sit in a group and we cover several topics for the day and make them fun. They're activities. Everyone's free to grab some breakfast, and then we sit in the group. We do a quick opening, which is sometimes mindfulness. Then we talk about a few topics that are pertinent in pregnancy, such as nutrition, common pregnancy signs and symptoms, intimate partner violence or what it is for the day. And then we do a closing, and then patients might have to go upstairs for their immunization or for their glucose test. So it is their prenatal visit, but it's done in a group setting.
In all the work that you've done, Dr. Lalani, if time flashed before you, what is one patient that stands out for you that somehow, if it wasn't for this program, they would have been at risk, or there would have been some serious consequences?
I can think of many, but I have one particular patient that stands out that is really struggling with healthy foods on the table. And I learned in one of our centering groups that the dollar store was the primary place that she does her groceries.
She lives in a food desert area.
She lives in a food desert, so has food insecurity, and the dollar store is not the best quality food.
Right.
There is no fresh produce. Well, she learned in centering that we have our Urban Harvest visiting. We're starting group prenatal nutrition classes, which an incentive to come will be that you'll get a box of produce. So hopefully we helped her have more nutritious foods at home.
I'm reminded of the quote of Thomas Edison that said the doctor of the future will not prescribe medicine, but prescribe foods.
Healthy foods and having a healthy diet and being the healthiest you can be is actually, being healthy during the prenatal time is important, but it really begins years before that. Putting nutritious foods in your body, maintaining the healthiest weight that you can, and being healthy going into the pregnancy. So it's not just your health during the prenatal period.
And how do you maintain that, to teach healthy living for children or busy moms and single moms and just everything that's going on in this fast-paced life? When it comes to educating children, do you do anything afterwards to talk to children and the importance of it? Because, foods and it's not appealing when it comes to children.
Well, by
these
teaching
days.
our moms healthy eating, they're passing that on to their children and teaching them healthy habits. We have another program called Walk with a Doc that one of our pediatricians does, and she has a group that they go walking in a park at our old Aldine location. And
While
so
they're getting consultation.
we're teaching physical activity
Yeah.
through actual modeling.
Yeah.
So that's how we try to reach out.
Behavioral modification through the act. Yeah.
Yep.
I read a study this morning in the New York Times, Dr. Lalani, that said that alcohol in any amount is is not good for the body. In fact, now there is strong correlation that is tied to cancer. Talk about alcohol and drug consumption during pregnancy and why mothers really need to take this seriously.
Yes, so we are finding out that alcohol is a carcinogen. And so in any amount, it can be linked to cancers. Alcohol during pregnancy can cause a syndrome called fetal alcohol syndrome. And so during that crucial developmental phase where organs are forming, you can get changes in the face as an effect of alcohol. So alcohol is not recommended in any amount during pregnancy.
It's actually recommended in no amount, even as adults. That made me pause to read the conclusion of this article, how people are at great risk for colon cancer as a result of alcohol consumption. Mm-hmm. It was really eye-opening. So that's what made me think about why mothers need to be so careful that they don't consume alcohol. And I'm sure that's part of your curriculum.
Of course, we do talk about the importance of avoiding not only smoking, alcohol, drugs, but also certain foods and avoiding medications unless you're sure that it's okay in pregnancy, safe in pregnancy.
So you talk about having this relationship with a child, even prenatal. Talk to us about the child born and how you're able to see this little one that you've been growing all along. What is that like for you?
So I get to see the babies when moms come back for their postpartum visit. So it's so special. I get to ask them how the delivery was, how their parenting is going, how their nights are going, and how being a new parent is. And then I get to see babies. I circumcise babies too, so I get to see them back for their circumcisions. And so it's so special to have that continuity where I get to see their babies grow with them.
Postpartum is a real thing.
It is.
What do you think, Vicky?
Oh my gosh, it is. It is. I mean, the body's changing. You're now having to, the mindset, encourage yourself. You have to constantly just stay on top of the game of ensuring that the baby's taken care of. And, it's just all these what ifs, barriers. And it's a real thing. It's a real thing.
What do you generally advise patients after postpartum?
So it's an overwhelming time. Taking care of a newborn it can be very, very stressful. And so we teach moms signs to look for. We have an activity that we do in centering, and we have cards that present a situation. And so we have what's called postpartum blues, and then we have depression, and then we have a very severe form called psychosis, and then of course anxiety. So we go through exercises where we all read a card and we say, well, does this sound like postpartum blues to you, which can be normal and is transitional and gets better as you get farther along in the postpartum period. And then there's postpartum depression, anxiety that you actually need to reach out for help, and then psychosis, which is a very serious and emergence type situation where you need to be seen by a psychiatrist as soon as possible.
Mm-hmm. So it is important to basically keep track of, stay close in contact. I mean, think about it. I mean, this mother now is basically carrying a baby, but you don't get to hear cry. You don't have to, feed yourself. You feed the baby. But then after, you're just basically, spending majority, if not all your time, caring for that baby. And basically, some mothers get lost in the process of, it's never about them anymore. It's just life is.
What would you like to tell our community, those that are watching us that are either pregnant or thinking about getting pregnant? What message as a physician? We're going to take you into people's homes so that you provide them general guidelines. What advice would you give them?
So I would like to advise patients, it's become very popular to have a birth plan. And moms look at how they want everything to go during their time in the hospital and during their delivery. And what I would say is that your birth plan should start many years before you actually decide to have a baby and get pregnant and have a baby. That you should start taking care of yourself in your early years, in your teen years. Put the healthiest foods you can in your body. Maintain a healthy weight. Stay active. And so that you're healthy going into your pregnancy. Because by the time you're pregnant, there's not much time left to get healthy, especially if we haven't developed healthy habits. So I would say being healthy in pregnancy starts many years before. Educate yourself. Try to put nutritious foods in your body and maintain a healthy, active lifestyle and a healthy weight before you become pregnant.
In a previous interview that I did with one of your nutritionists, they were talking about creating meals and using recipes of their ethnic origin. Talk to us about that particular. Is that still in force? The ethnic food preparation?
Yeah, so it's great to give patients advice about a healthy diet, but if it's not practical and they're not being taught how to implement those ideas in their own ethnic foods,
It has no use.
it has no use. So yes, we have a chef who does cooking classes, and we do it in an ethnically competent manner. So we make sure that we're applying it to foods that are actually being eaten in the home.
Nice.
One of the things that amazed me is that even the patients are encouraged to bring their own spices so that again you have the flavor of what they are accustomed to having as well, not only in the home but also in their meals.
How nice is that?
Yeah.
I mean, because it also, you can be cross train or not cross serve, these different menus. Like international,
Yeah,
international,
absolutely, yeah.
international cafe cuisine. Or,
I can just see you wanting to be there.
yeah, next show we're going to Hope Clinic
Yeah,
Live.
there's
live.
basic principles that can be applied to any cuisine.
Nice. So you've heard about the hero. You know about Mission One USA and how
beautiful.
Yeah, the unity in the community. How do you feel about that? I mean, I was just listening to her and I said, it's kind of just how we
It's synergistic,
parallels-
yeah.
Synergistic.
Well, we're all human, and it doesn't matter what the color of your skin is, what language you speak, what religion you are. We're all humans, and we all deserve to be happy and healthy and be treated with respect.
Absolutely. And so that's, what we thrive on. We thrive on educating. I think that, here with Mission One, we feel that we just really want to be a part of educating our communities on, cultural differences, to cultural intelligence. I know that Victor and I talk about that all the time because there's a gap. Do you find that gap, when it comes to developing children, that the lack of understanding or of the cultural differences? I mean, do you see that among the children that just like that?
Well, I think, all of these are barriers. They're barriers to good care. And by not having access to good, high-quality medical care, it's a barrier to being healthy. And so definitely we see that with a high underserved, uninsured population in Houston.
Wow. And so it's noticeable as well in the medical industry.
Definitely. Barrier to good, high-quality health care affects everybody.
Mm-hmm.
What is upcoming for Hope Clinic? What other initiatives does Hope is always doing new and innovative things? What is in the horizon for Hope Clinic?
Well, we would love to expand to other parts of Houston so we can serve other underserved areas. We hope to expand centering pregnancy, continue to grow, maybe have not just one hospital where we can deliver babies, but maybe 2 or 3 hospitals. We want to expand care because this model of community health centers that serve populations that are underserved is so vital and so needed in Houston.
And sometimes you have cultural events to where you invite the community to come get to know Hope Clinic. Is there anything in the horizon?
We are always planning health fairs. We have regular baby showers where we invite moms to come learn about programs available at Hope Clinic, and we give out goodies like diapers and wipes. We are always out in the community, in the schools, working with the different school districts such as ALEAF and Aldine ISD. So we are outreaching in so many different ways.
Amazing. Yeah, so we do have events from time to time. We have one this Friday. I'm not sure if you have a clinic. Did you say near Pasadena? There's no South Houston or anything?
We do not have a location in the southeast part of Houston.
Not yet.
Not yet.
Not yet.
Not yet.
No,
Another area we need to reach.
Yeah.
Yeah, that would be nice, right? To have them
Absolutely.
over, just join and partner in to educate our families.
There
Educate
are
our
other health
community.
centers in the southeast part of town. So I encourage anyone who is in a part of town where there is not a Hope Clinic to look up federally qualified health centers, because we're all doing great work.
Great. Great. And so is there anything else that you would want to share over to the community just in your heart that when it comes to developing, a child?
Well, as I say, knowledge is power, and I encourage you to, get the knowledge from a reliable source and use that to help raise healthy children.
And what is your website if our listeners or viewers want more information, Dr.
It's
Lalani?
www.hopechc.org.
That's a long name, so we'll put it in the comments. We'll put your link in the comments
Wonderful.
that our viewers can access.
Absolutely. And so the next 5 years, what is Hope doing? Do you know?
We're looking to expand.
Just expand.
We're looking to expand and increase our programs, increase our access to health, to high quality care, and increase our programs that help our patients be healthy.
You know what I was thinking about right now? She was talking was remember the high schools that we had come across, those high schools that had asked about just educating. Wouldn't that be nice to have the Hope Clinic there as a resource
Absolutely.
in these schools where there's these teenage moms?
Yeah, sometimes being exposed to role models like that, you can have an impressionable young high school student decide that they want to do that, that they want to deliver babies, they want to care for families. You just never know.
Yeah, we're hoping another thing on the horizon is we're hoping to partner with medical assistant schools and give patients in different parts of Houston an opportunity to become medical assistants. So that's really an exciting program that we are hoping to implement. And then I also want to talk about HIV PrEP. We're hoping to increase our screening for HIV and implementing HIV prevention through what's called PrEP. So that's another exciting, we need to increase our prevention in the HIV arena.
And speaking of immunizations, I wanted to just ask about what about COVID now for little ones? I saw something that as early as 6 months old inside your...
There are immunizations for 6 months and beyond. So I encourage patients to reach out and make an appointment with our pediatricians to discuss the COVID vaccine.
Okay. Yeah, I had to.
We got 5 minutes. Dr. Lalani, this is the season for colds, flu, and COVID. What general advice do you give to parents for caring for kids and family members?
Please get immunized. Immunizations, there's a lot of misinformation out there in social media and a lot of suspicion about vaccines. But vaccines have been proven to prevent disease. And we're starting to see diseases that we haven't seen in many years because of under-vaccination. So please get your vaccine. We have an RSV vaccine now. There's the COVID vaccine that's been updated with the latest strain that's going around. The flu vaccine is now available, and flu season's coming up. And so we call it the trifecta between flu, COVID, and RSV. We're going to see a lot of sick people and sick babies. So please get immunized.
And you guys, I mean, does your clinic, does Hope Clinic, go to different events like that to...
We do. We have health fairs. Our website will, and LinkedIn and social media, we advertise the health fairs that we're going to be having upcoming.
That's great. That's great. So no, because, yeah, that's awesome.
Immunizations are a cornerstone of prevention.
Okay. Well, no, I mean, gosh.
4 minutes.
4 minutes. Anything else?
What else can I share? I love talking about centering, but we have other programs too. We have another program called Food RX for Health, in which patients that have diabetes can come to our food pantry that's at our Hope A-Leaf location and get fresh produce. They can have their hemoglobin A1C checked to see how they're doing with their glucose control, and get a box of fresh produce. We have a chef school, actually, where we train community members who are interested in having a restaurant or having a food truck or having catering
Imagine that.
services
Imagine.
out of their home, and we treat them hygienic practices and help them get their license to
Where's
be able
this
to
school
cater.
at?
The school is at our Hope Clinic A-Leaf location.
The A-Leaf location. Awesome. That's good to know.
That'd be great.
That
to-
would be great. We need to visit.
Yeah, we do.
So is it every day that you're doing, I mean,
We have cohorts.
Okay.
So right now we're taking one cohort through their training, and then when they graduate, we'll start a new cohort.
nice.
Give us the phone number that people can call Hope Clinic if you have it. If not, I can look it up.
713-773-0803 is our number. 713-773-0803.
There you have it, listeners. You have all the information at your fingertips for you to access high quality care. If you have insurance, if you don't have insurance, they will see if you qualify for either probably a sliding scale or free
Sliding fee.
services.
Sliding
Yeah.
scales
Everything.
or any sort of additional resources. I mean, most importantly is the education. I mean, who does not lack education in
Yes.
some way? So I think, yeah, I mean, it's amazing what you're doing, how you're working together as a community. That is so important. All the language opportunities that are there, right? The just the cross-cultural. So I think that's amazing what you're doing and providing, and most importantly, the relationship, the love, the time, because it's not something that just doctors'
We do.
offices provide. So I thank you so much for what you're
Thank
doing
you.
for these lives, because, and that's it. So, listeners, again, we thank you so much for thank the Hope Clinic for being here.
Thank you for having me.
Absolutely, and thank you, Victor.
Thank you, Vicky. That's all for today.
That's all for today. Until
Have a
then,
great week, and we will see you here at the same time, same day.
absolutely.
Have a
Thank
good
you.
day.